Welcome students. Today we will study about anatomy of vagina. Vagina that you can see here, in which cervix is projecting, and so a gap is seen between cervix and vagina. So one name, as you know, the commonly called name is vagina. The other name is colpos, and that is why when we see it, it is also called colposcopy. The instrument with which we see any pathology here, it's called colposcopy because the name is colpos. So here, vagina, you can see it is a muscular, fibromuscular tube, quite tubular structure, and the inner lumen is lined by mucous membrane. The mucous membrane has to be present everywhere, and here you can see the muscular layer, and as you can see, it is longitudinal tubular structure, but its dimension is different. The anterior wall is 8 cm long, while the posterior one is 10 cm long. So the posterior vaginal wall is longer compared to anterior. That is why this is the axis of vagina. Okay, the anterior is going to be, anterior wall will be smaller, and over it the uterus is going to be present. Suppose I will take this as the vagina and this as uterus. There is an angle between the axis of uterus and vagina, and this angle is of 90 degrees and is called anteversion, and this is one of the reasons for preventing the prolapse of uterus. So this was the dimension of uterus, the vagina, the length of vagina, which you can see it is variable. Now the thickness is also variable. Remember again the figure of 2.5. The lower end has a diameter of 2.5 centimeter, and the upper end, you can see it is quite broad compared to the lower. Just increase the number by 2.5, so it becomes 5. So here the upper end is 5 centimeter in diameter. In the lower region, this muscular fold that you see, this is a little exaggerated from all sides, and that exaggerated muscular fold at the opening of the lower opening of the vagina is called hymen. So the vagina is extending from vulva up to the cervix, and when it reaches the cervix, it is having a gap between, there's a gap between both, and which is called fornix. Anteriorly it will be called anterior fornix, posteriorly posterior fornix, laterally lateral fornix. The relations now, it's very simple. Since anterior to both uterus, cervix and vagina, anterior to all these structures is urinary bladder, and below the urinary bladder is the urethra. So the upper part of vagina is related to urinary bladder, the lower part is related to urethra anteriorly, and posteriorly since the posterior wall is long and broad ligament is lying over the whole uterus, it is going to reflect back along the anterior border of rectum, and when it is reflecting back, there is going to be something like this. A pouch will be formed, okay, a pouch, and this is called pouch of Douglas or uterorectal pouch. So this pouch of Douglas is very important. So the upper part of vagina is posteriorly related to the pouch of Douglas. The middle part is related to lower part of rectum, and the lower part of the vagina is posteriorly related to anal canal. So these were the anterior and posterior relations of vagina. Blood supply, it is supplied by the internal iliac artery and uterine artery, which is going to supply from here. The same is about the counterpart, veins are going to drain the vagina. Now the lymph nodes. Now here again there is a difference. The upper 1/3 of the vagina will be drained by external iliac lymph nodes. Middle 1/3 of vagina will be drained by internal iliac lymph nodes, and the lower 1/3, since it is near the vulva. Vulva means the external female genitalia, consisting of labia majora, minora. Okay, that's called the region called vulva. So since it is near them, so that area is drained by the superficial inguinal lymph nodes. So the lower 1/3 of the vagina will be drained by superficial inguinal lymph nodes. Now we come to the nerve supply. The lower part of the vagina is pain sensitive, so it is supplied by the pudendal nerve. But the upper part is pain insensitive, so it is supplied just like the cervix and uterus, ovary, fallopian tube by sympathetic and parasympathetic nerves. Now the applied anatomy. In the vagina we can have infection called vaginitis. Then when we suspect cervical carcinoma, we do a pap smear. Pap smear means a swab is taken from the posterior fornix of vagina, and then a smear is made, and that slide is studied for that whether the carcinoma is there or not. Then vagina becomes distended so that the fetus, see, the fetus head is so big, isn't it? And I just said that the lower part is just 2.5 centimeter in diameter, upper part is 5 centimeter in diameter in normal condition. But during delivery, the whole vagina will distend along with the head of fetus so as to assist in the delivery. So these were the applied anatomy, and there are many more, but this is sufficient. This also acts as a passage for the passage of sperm, so that the fertilization can take part here in the fallopian tube. Then the embryo will be implanted in the posterior wall of the fundus of uterus. So these all structures, they are forming the part of reproductive system of females. Thank you.